Thanks for watching O&R. I'm Liz Exon. Time is running out, and if lawmakers don't act very soon, we will see the decimation of Oklahoma. That was the message given to lawmakers as the fourth week of a special session ended with no agreement to fill a $215 million budget hole.
Mental health professionals and community leaders from around the state stood with the executive director of the Department of Mental Health and Substance Abuse Services as she outlined the plans to cut $75 million, or 23%, of the agency's budget.
These cuts that I'm going to discuss in detail are unbearable. They will decimate the state's behavioral health system, and in particular our outpatient network across the state.
Terry White says the department had one of two choices: cutting inpatient services for the sickest of the sick, or outpatient treatment for those people who will get sicker without care.
Therefore, we're forced to start with outpatient. In order to achieve a $75 million cut in the last 6 months of the year, we will have to eliminate every outpatient service available in the state of Oklahoma, with the exception of medications.
189,000 men, women, and children receive state-supported mental health treatment each year. Many of them have brain diseases like depression, anxiety, or schizophrenia, or they may be addicted to drugs and need help in recovery.
It includes the elimination of all outpatient programs, which means there are no treatment services for drug courts. There are no treatment services for mental health courts. There are no PACT programs. There are no systems of care programs, the program that serves our children with the most complex mental health and substance abuse needs on an outpatient basis.
Gail Lapidus is the Chief Executive Officer of Family and Children's Services, the largest nonprofit mental health center in the state.
Hearing those programs mentioned, including our own Tulsa COPES team, it was like taking a knife and putting it right through me. Our COPES team alone intervenes in half a dozen suicides a day. There will be no COPES team. Many potential homicides are diverted and ended because of the COPES team that are out in the community reacting quickly with first responders to provide community safety and individual safety.
And Lapidus says schools will no longer have mental health professionals to counsel troubled, disruptive students who may have dysfunctional home lives.
And that will disrupt learning for every school child in the state of Oklahoma. And I don't think our legislature has a right to do that. Do you?
Some of those children may be dependent on parents who will no longer be able to care for them because drug and mental health courts will be shutting down. Right now, 4,600 Oklahomans are involved in drug or mental health courts. Richard Smotherman represents district attorneys across the state.
That means 4,600 Oklahomans that are leading meaningful lives right now and are going through these systems as an alternative to prison will have no other choice but to go to prison. 4,600 new intakes into an already saturated prison system.
Children placed in foster care that desperately need therapy will no longer have services, and those children that end up in the juvenile justice system will also have no access to mental health support. Stephen Buck is the executive director of the Oklahoma Office of Juvenile Affairs.
I know that today 50% of the young people in the care of my agency have an existing open file for behavioral health services. That's 50% of the young people in my agency's care and relationship have an existing relationship with a provider. I know also that a minimum of 1/3 of their parents are actively involved or have been in recent history with some level of treatment engagement.
Joyce Sloan is the CEO of Green Country Behavioral Health based in Muskogee.
Brain health affects every other system that we have. It affects education, it affects law enforcement, it affects courts, it affects our economy. There will be total devastation if the legislature fails to act.
As far as the economy, thousands of jobs will be eliminated. Terry White says 300 state employees will lose jobs, but that number is a fraction of the total.
This will affect approximately 700 agencies across the state. Those agencies employ about 8,800 therapists, doctors, case managers, and nurses, not to mention the hundreds of support staff.
But the axe hasn't yet fallen, and White believes lawmakers can still stop this plan from being carried out.
Our hope is that a solution is found. I believe there is still time. If there is a solution found before the first week in November, we do not even have to begin the process of implementing cuts. If we get to that point and there's not a solution, we will begin the process. If a solution is found before December, those cuts will not have to go into place.
Many attending this news conference are angry at lawmakers. This is what Gail Lapidus thinks.
I almost feel like we're reaching the point of anarchy in Oklahoma. Not the traditional violent form of anarchy, but nonviolent anarchy where government is not governing. The people that have been elected to represent the people of Oklahoma are not governing. And I'm mad about that.
It is time, past time, to make a decision on the budget. Every day that goes by without a budget decision is a day we step further towards the cliff. Indecision is a decision, it's just not a very good one.